My name is Professor Nick Hart. I am the Chief Investigator for the Home Oxygen Therapy Home Mechanical Ventilation Trial in COPD, the HOT-HMV trial. So the HOT-HMV trial was to test the hypothesis that we could add a further treatment to a group of patients with COPD that had very little treatment options available to them. These patients are severely sick. These patients are actually moving towards the end of life, and we have very little treatment options. The trial was designed to test whether home oxygen therapy, in addition to home mechanical ventilation, was better than the standard usual therapy of home oxygen therapy alone. In the trial, we used time to readmission or death as the primary endpoint, and this was called admission-free survival. In this sick cohort of COPD patients, what we actually found was the time to readmission was prolonged by using home non-invasive ventilation in addition to home oxygen therapy. And what we found, there was an increase in the readmission time from 1.4 months in the control group to 4.3 months in the treatment group. And what we actually found was the readmission rate of the patients reduced significantly. Indeed, the 28-day readmission rate fell by 2/3. There was a fall in the exacerbation rate by 1/3, and by 6 weeks, there was an improvement in the health-related quality of life of the patients. So the patients felt better and didn't get readmitted to hospital. We were using a group of patients that were very sick. These patients had a high carbon dioxide level. They had chronic respiratory failure after an acute exacerbation of COPD, which required them at the stage of when they were very sick to receive acute non-invasive ventilation. After the patient had survived their life-threatening exacerbation, we saw them in the clinic at 2 to 4 weeks, and if their carbon dioxide was elevated above 7 kilopascals or 50 millimeters of mercury, they were randomized into the trial, and they were randomized to receive home oxygen therapy or home oxygen therapy and home mechanical ventilation, and hence the term we use for the trial of HOT-HMV. There's been previous studies that have shown that the carbon dioxide level when patients have been very, very unwell actually returns to normal. We didn't want to use a treatment where the patients had actually recovered. So we wanted the patients who had ongoing issues with persistent hypercapnia and they had chronic respiratory failure. And so we wanted to enrich the target population to ensure that we gave the best opportunity for a positive outcome for this study. So what we wanted to do was make sure we were treating severe COPD patients. We didn't want patients who were obese, because the treatment of a COPD OSA, COPD obstructive sleep apnea overlap, is much easier than a pure COPD patient. And so we wanted to be clear with the patients that the actual treatment was going to help. So we needed to know the COPD phenotype. We had patients who had come into the hospital. The patients had received acute non-invasive ventilation because they were sick and they needed support during that initial critical illness. Once they'd recovered and their carbon dioxide level had not fallen, then they were randomized into the trial in order that we could see whether home oxygen therapy and home mechanical ventilation was superior to the standard treatment with home oxygen therapy. These findings are potentially a game changer. They're a game changer to the treatment of these very severe COPD patients where we have few treatment options available. we would anticipate, and indeed what we've done in our own institution, is set up a clinic to review these patients at 2 to 4 weeks after hospitalisation. And we review them, and if their carbon dioxide level is elevated above 7 kilopascals or 50 millimeters of mercury, then in addition to their oxygen therapy, they will be issued with non-invasive ventilation. We will admit them for an overnight titration study to ensure that the pressures on the ventilator are set correctly, and this will reduce the patient readmission to hospital at 28 days, but importantly over the first year after initiation of home non-invasive ventilation. I'd like to thank all the patients that took part in this study. This was a very sick group of patients, and all of them agreed to be in the study. I'd also like to thank the clinical trialists involved, which is the HOT-HMV research network based in the UK. And I'd also like to thank Dr. Patrick Murphy, who led the study and was the principal investigator.